Dr. Conrad Baars, Emotional Deprivation Disorder and Affirmation Therapy. Today on The Simple Truth, we consecrate everything to the Sacred Heart of Jesus through the Immaculate Heart of Mary and the pure, strong, chaste heart of Saint Joseph. I'm your host, Jim Havens, and our guest today is Dr. Suzanne Baars. She is a licensed professional counselor and marriage and family therapist with a private practice in Irving, Texas. Sue has worked extensively in the field of counseling since 1986 in both hospital and outpatient settings, and focuses her work on the integration of the Christian anthropology of St. Thomas Aquinas with the treatment of a variety of emotional and spiritual problems, among them emotional deprivation disorder, obsessive compulsive disorder, and scrupulosity. She often presents the work of her late father, psychiatrist and author Dr. Conrad Baars, a pioneer in the field of Catholic psychology. Sue cites the cultural erosion of the family as the root of the lack of affirmation from which many people in our time suffer. You can learn more about her and her good work, along with our topic today, at baarsinstitute.com. That's baarsinstitute.com. Also a great CD set there that Sue has entitled The Abode of Love, Developing the Heart, a set of 10 CDs. Highly recommend it. I remember it from some years ago, and very, very helpful. But Dr. Sue Baars, welcome to The Simple Truth. How are you today?
Jim, thank you so much. I'm doing very well. I appreciate you having me on your show. It's a delight.
Yeah, I'm very, very excited to have you on and hear from you and to learn more about this topic. So let's dive right in. Let's begin with your father, Dr. Conrad Baars, who lived from 1919 to 1981. How do you describe him and his work to someone who has never had the blessing of hearing of him?
That's a great question. My father was a Catholic psychiatrist, and he and his colleague and mentor, Dr. Anna Terua, who was a Dutch psychiatrist. My father was also from the Netherlands, originally became an American citizen, but they were pioneers in the field of Catholic psychiatry and psychology. And they're still known that way, even though there's a lot of people in the field now who try to integrate their Catholic faith into their work as therapists. And what they did was they looked at St. Thomas Aquinas, and they had a mentor who was a Redemptorist priest, Father Willem Dienstay, who sort of helped them to start looking at how St. Thomas identified the psyche of the person, or the intellect and the will, and how they guided the emotions, and so that there was an order within the human person that we could look at to say, oh, this is what it means to be a normal person. And then what they began to look at was, well, when we have these kinds of issues, like they identified something which originally they called deprivation neurosis, and now I'm calling it emotional deprivation disorder. And they also looked at another disorder which had more to do with repression. But they looked at it through this Thomistic lens, or the lens of St. Thomas Aquinas, so that we could look at how do we help to correct these issues from a Catholic perspective, from the perspective of what does it mean to be a human person. And so all of the work that I do and that we do in our practice, and as I'm trying to teach other therapists, we're trying to do it from this perspective and this foundation. And that also oftentimes it helps people to feel more at peace coming into therapy, or even looking at the books that my father and his colleague wrote, because it's all based on a Catholic understanding of the person. So there's been a lot of success with it. I think it's very helpful in my work as a therapist. It's just been such a beautiful thing. And when I was really discerning what the Lord wanted me to do when I was a young person, reading the books themselves was just so inspirational, and it became very crystal clear this is where the Lord wanted me to be. And it's just been such a blessing to me as a therapist and personally, but also just to be able to give it to other people and to use it to help them to heal and to grow as persons.
Yes, it is really outstanding work, and thank you so much for so grateful that you said yes to that call, and so the many books that were written by your father, Dr. Conrad Baars. Among them, it includes "Born Only Once: The Miracle of Affirmation," and also "Feeling and Healing Your Emotions: A Christian Psychiatrist Shows You How to Grow to Wholeness." So you can see how important these topics are. We need to get this right if we're going to have a proper understanding of how to help somebody to really get to healing and wholeness. Vital distinctions need to be accurately parsed, and this work is incredibly important. I was very grateful as well to find the work of your father recently in a talk that he gave October 1981 at a meeting of the National Federation of Catholic Physicians Guilds, and this was published after he died. He died of a heart attack approximately 2 weeks after this talk was given. So I treasure the words here as really a distilling, it seems, of a lot of his work. What was in his mind as he had been through all of his work to this point, and really a beautiful talk that he gives. Some very, very helpful distinctions, and I want to lay it out this way and get your comments on it. The way that he explains this topic that we're getting into, that I think is very helpful for people to understand the way he lays it out this way. He says a subject. He says this is a subject which pertains to all of us, and the title of this talk was "Psychic Wholeness and Healing for the Family." He says this pertains to all of us because as Christians, we all have to be like Christ, who was the first affirmer, the first healer of mankind. This process of healing is one which, in its essence, completes the biological process of bringing a child into life. It is a process which I have called the second birth, or the psychic birth of the child, a much more difficult process than the physical delivery of a child because it involves the efforts of at least two persons, the father and the mother. It is something which some parents do spontaneously and naturally because they were given this gift by their parents, while others who were never given this gift are not able to do this, or only to a limited extent. Yet there is much that can be done to learn what is necessary to be a true, authentic affirmer of other persons. Affirmer here means healer, someone who reveals to another his or her own goodness, worth, lovableness, and opens him to his or her own goodness. As a result, that person can, in turn, become an affirmer, a revealer of the good of other human beings. In fact, it is a necessary process if that person is able to become open to his own goodness, the goodness of creation, and the goodness of God. Sue Baars, what else would you like to say about this?
Well, I think that's really the highlight, or the main point of my father's work, and really his legacy, because he called this way of being affirmation. And then later in his life, he said, I was trying to translate Dr. Terua's word that was in Dutch that had this meaning, and I'll tell you the meaning in a second. But he said, now I think that people take that the term affirmation, as something that you do to somebody else, like to help them. And he said, it's really not. He said, at this point in his life, and that was probably, within the last 10 years of his life, he said, I would call it affirming living because it's more a way of being. It's not something that you do to or for another person specifically, but it's a way of being. And the beautiful thing is, in the book Born Only Once that you just held up, they define what affirmation is, or affirming living is. It is a 3-step process. And the first step is to practice being open, attentive, and receptive to another person. And you can also practice this by being open, attentive, and receptive to anything in nature, the fine arts, literature, anything that you find that is moving and good or true or beautiful. It can be very, very simple. But the first step in being with a person is to be open and receptive and attentive. So it's like you're not going to do anything to them. You're more in a receptive mode. And that's very different than how we live in this country, as we're very much into doing things and helping people, which is all very good, but it is not affirmation. So the second step is, as you are with the person and over time, as you get to know them and you're receptive to them, is you permit yourself to be moved as however you're moved, maybe with delight or liking or love for the person, however it is, or compassion. Sometimes it might be pity. And you just allow those feelings to grow in you as they do on their own, at their own pace. And then thirdly, when you have these feelings, that we sort of have a choice. And in that choice, we can allow ourselves to reveal how we feel, how we are moved by the other person. And we reveal that in our countenance, in our tone of voice, in our choice of words. And I find that that's the way to be affirming is really a shift, not just in therapy, but certainly in therapy, because in graduate school, we're usually taught how to help people very actively and to get them to do things. And again, none of that is bad. Some of it is very good. It's very necessary. But the way to be affirming is to start with just being open and being receptive, because many times people have never really been, as you were saying, Jim, received by the most important people in their lives. And so they haven't had somebody to really be present to them, to just be moved with love for them, that they could see in your face. And if you think about it, if your listeners think about it, if they think about when they know, when did they really know that somebody loved them? It was when they saw the look in their eyes and heard the tone of voice. And it was a very simple thing that really moved them in return, so that they felt received by their parents or by another person. And that's a very different feeling. It's a very wonderful feeling to be loved and affirmed in that way.
We're going to be right back. Stay tuned.
Knowledge is one of the 7 gifts of the Holy Spirit. It enables us to discern right from wrong and stay on the path to holiness. How can knowledge of God's truth guide your journey and help bring others closer to Him this year? iCatholic Mobile supports the Station of the Cross in sharing knowledge that leads souls to Christ. More info at iCatholicMobile.com. iCatholic Mobile underwrites with the Station of the Cross.
Welcome back to The Simple Truth. Jim Havens here with our guest today, Dr. Sue Baars. And if you want to give a call, any question, any comment that you might have today, 1-877-511-5483. That's 1-877-511-5483. And Sue, I appreciate your comments at the end of that first segment. I do read here from your father's address that, he talks here about where this term affirmation and then affirming living, where this comes from. He says, yes, it came from when in 1950, when he translated some of the books of Dr. Anna Trua and his colleague in the Netherlands. He says it's a psychological term, affirmation, affirming living, which we have taken from Luke 22:32, where Jesus speaks to the apostles and admonishes them to become like he had been to them, a strengthener of their brothers. His actual words were, "Now you in turn must strengthen your brothers." So if anybody gets hung up on that term affirmation because they're more familiar with the sort of pseudo affirmation, the fake affirmation that we hear when we hear the word affirmation, and we don't really understand what it is that is the genuine truth that is being spoken of here that we need to see, you can think of it as a strengthener, one who is strengthening, a way of living that strengthens others. And you can go right back to Luke 22:32 when Jesus speaks this to the apostles, specifically to Peter in this moment. And he says in this talk, I'm going to talk about the essence of healing, the psychological essence of healing, a beautiful concept, a profound concept, something I never learned in my training training as a psychiatrist, a secular humanistic training. So again, if you don't get this, if this is off at a foundational level in the way one understands things, they're going to be very limited in the way they can help others. They may even go about hurting others unintentionally if they don't understand truly how the human person works. So we really do need to have this Thomistic framework to understand a right Christian or Catholic anthropology of the human person. And he states here, I think this is, again, helpful to help people to understand how important this is. He says, first of all, when we do not affirm our children or open them to the goodness of themselves, they will never have the sense of feeling good, worthwhile, loved for themselves, loved because they exist, not for anything that they have done or what they do. In other words, their emotional life never develops. He goes on to give some examples, but Sue, I wanted to ask you, is the right way for us to look at this, is it that we should see this sort of emotional deprivation disorder as a sort of spectrum, or is it maybe better to look at it like the affirming living, that this would be something of a spectrum, and that this emotional deprivation disorder would be at the bottom of that spectrum, and perfect affirming living at the top, and we want to be moving in that direction. How do you look at it? What's the vision that you share?
No, I think that's perfect. That's exactly what I would say, is that I sort of look at it as a spectrum from one end to the other, like the most severe deprivation of love, where you have, the worst symptoms, the most difficult symptoms for a person to overcome, but it can be overcome. And then you have something more in the middle, where we would call it the unaffirmed state. And I'd say maybe most people are there, a lot of people are there, so it's not quite as severe. But then you have, way on the end, you have perhaps the Holy Family, right, who are the perfect affirmers in this world, and you have a lot of families close to that or wanting to be there. But I think when we go back and we look at this other end, this emotional deprivation, and I called it a disorder, but now I also think I really should have just called it a syndrome, because it's not a disorder. It's sort of a lack of what the person needs. It's sort of like, you wouldn't say it's a disorder per se if somebody had not gotten enough food. You just say they're malnourished, and then you give them more food. Well, that's very similar to what we're talking about here. But I do want to give your listeners an idea of what the symptoms of emotional deprivation are and what we're talking about. And because they have not received adequately, let's put it that way, the unconditional love through this affirming way of being from their parents, or maybe it's inadequate for them in particular. Oftentimes, when their emotional life does not grow normally to catch up and be integrated with their mind and their spiritual life, then they could feel in the most severe cases, people sometimes feel like little babies, even though they're adults, or they feel like children, and they won't tell us this necessarily right away. It's only when they begin to trust that somebody's really going to take them seriously and really hear that. Or some of them feel like more teenagers, right? Like, I'm not quite the adult that I am supposed to be at such and such an age. And so it's very difficult, as you can imagine, to live in the adult world where you're expected to act like an adult, think like an adult. And so a lot of times those people cannot get there. And so they can be very good in business or in their job, because that usually doesn't involve their emotional life. And so they can be good accountants and good attorneys, but in their relationships with other people or with their families and in marriages, they cannot do it. They feel like they fail miserably because they don't even understand what it is like to have a peer-to-peer relationship with other people as an adult, because internally they don't feel like adults. And so this is where we're in therapy, we're helping, once we can identify that, we're helping the person by affirming, as they talk about their experiences of life from the past and even in the present, we're affirming, you might say, their thoughts, their feelings, and their desires, in the context of just sort of looking at that. Because most of these people, if they're how would I say it? They want to be connected and they want to be loved by others and liked by others. And so many of them are trying to please other people or be what the other person expects them to be. And so that's not really normally how we operate as adults. We operate in terms of, I have my own thoughts and feelings, and I'm going to share those with you. And I learn how to, hopefully we learn as we're adults, how to go back and forth with if we have disagreements. But the person who has been deprived of affirmation to a significant extent really is always trying to make themselves be what other people want them to be and what they think they want them to be. And so what I usually tell them is, it sounds like you have been more focused on what you think everybody else thinks of you than what you think about things and how you feel about things. And so in affirming their own feelings and thoughts and helping them to learn what does it mean for them to begin to live the affirming life, now we're helping them to develop the emotions and to pay attention to the emotions and to actually learn how to process through those, like when they feel angry, perhaps, or maybe they've never felt angry with people because they didn't think they could, or they were never allowed to feel angry or irritated. And so in the safe place of therapy, we're helping them to really look at those things and eventually catch up. Part of it also is, I think, helping them to feel, and I've heard many people over the years, I've noticed people say, I've begun, not just with the therapist, with me, now maybe with other people, I have begun to feel seen and known and understood and cared about. And that is a new experience for them. And so it's sort of like they've been operating in this little isolated way in life as an adult, or ostensibly as an adult, but feeling on the outside of things and not being able to really establish good rapport as an adult with other people. So we're trying to help that process continue. And that's where I'm saying it's not exactly a disorder. It's sort of like it stopped or it never got started when the person was young. And so we want to help pave the way through the therapeutic relationship for that to happen and the person to become more open to themselves and accepting of themselves and their own humanity and even their own weaknesses, like we all need to. Because oftentimes they're very critical of themselves, they hate themselves, and so we want to help to temper that through how we are with them. And that's very different from most other different therapies. Some therapies are sort of learning to incorporate what I would call, affirming presence into their therapies. I don't think they know about us in this work, but I think I really always applaud it when I see it. Because it's not just about like a distant relationship with the therapist, that in the case of these persons, they need someone who is warm and cares about them, still in a professional relationship, but who they know that they can depend on and they can trust because they feel understood. And so all of these, what we're trying to do again is try to help them to catch up and for that emotional development to catch up to where they need to be. And in the process, what we see is the anxiety and the depression and the sense of hopelessness and helplessness drop as the person begins to feel more like it is okay for me to be myself. I don't just always have to please other people and get them to like me, because then they can never be sure that the person really likes them for themselves because they've sort of tried to make it happen or tried to please them. And that, of course, is never a sure thing. So we want to help them to also learn eventually that they're not going to be able to get the love of every person, and that they're going to have to grieve that, like we all do. Like sometimes we're going to be disappointed, but we do want them to be able to get to a place where they can feel at ease with other adults, with their family members, with their spouse, perhaps, or with friends, so that they can really be themselves with other people and really be able to live more effortlessly and spontaneously and joyfully, which is really God's plan for us. You know, when He created us in His image, He wants us to be able to experience the happiness that we're designed for, not just in the next life, but in this life as well.
Yes, Dr. Sue Baars is with us, BaarsInstitute.com. If you want to call in any question or comment today, 1-877-511-5483. That's 1-877-511-5483. In this talk your father gave, Dr. Conrad Baars, 1981, he says what you're saying there. One sees oneself as a child among adults in their late teens or 20s, surrounded by what appear to be adults, fearful all the time, never leading their own lives. Sooner or later, they become depressed, the main symptom of being unaffirmed, obviously because they do not live their own lives. He goes on to say, no one can effectively affirm himself. One can only be affirmed, can only receive the gift of himself from another person. One cannot give that to himself. This was one of the most profound points that struck me when I was reading your father's book for the first time many years ago, Born Only Once. And I hear the music there, so we'll hold this question until we get back from this hard break. But want to ask you about that, because that's very important to see and to understand. And why is that? Why is that one can only be affirmed, can only receive the gift of himself from another person? One cannot give that to himself. Why is that the case? And why is that so important for us to see and understand? And really, then what is the power of knowing that? How can one be then open, I guess, and ready to receive the affirmation that another wishes to give? So how does this all work together? And so we're going to be asking that to Dr. Sue Baars when we get back, but plenty more here to unpack and build on. So stay tuned. We're going to be right back. Welcome back to The Simple Truth. Jim Havens here with Dr. Sue Baars today, BaarsInstitute.com, to learn more about her and her good work, and also that of her father, Dr. Conrad Baars. Again, BaarsInstitute.com. And again, highly recommend that 10 CD set, The Abode of Love, Developing the Heart. You can find it there at BaarsInstitute.com. If you do want to call in any question or comment today, 1-877-511-5483. That's 1-877-511-5483. So that question I was posing before the break, that one cannot affirm themselves. Your father puts it this way in his book, Born Only Once. He writes that, he says, stop trying to affirm yourself, to prove to yourself and the whole world that you are worthwhile and good. He says, although I have discussed this extensively in the previous chapter, and he's got a whole chapter devoted to it, the futility of self-affirmation, he says, I just wanted to remind you again, only another human being can affirm you. Only another person can give you to yourself. For him, you can only wait in patience, unhurriedly, in openness. Sue, what more can you share with us here?
Yeah, I think that's a great point that you are making there. Well, I think the thing is, number one, we're made in the image and likeness of God, and God is a communion of persons. And God has created us ideally and really by nature to live in a family, to be in a family with other people, with someone who's going to take care of us. And so we're not meant to live in a vacuum all by ourselves and to do everything for ourselves. Even just if you look at our nature from another point of view, as babies, human beings need, from babyhood on, they need to be nurtured, not just emotionally, but physically. They need to be given good food. When they get a little older, they need to be taught intellectually, and that's why we go to school. And then we need to be taught about the faith. Well, all these things come from the outside. They come from our parents and our families, and then our teachers. Well, we don't do those things for ourselves. We don't, good parents don't just leave children to fend for themselves. They have to provide that for their children. Well, it's also true in the emotional realm. In the psychological realm, people need to when we're designed to love and to be loved first and to love. And so when we are given something, it's like many people will say this, we cannot give away what we've never received. We can say, well, I'd love to give you $1 million, but I've never gotten $1 million, so I don't have it to give you. Well, it's the same way with love or with being strengthened. It's like emotionally that being loved and being accepted for ourselves, not for anything that we can do or provide for others, that it really strengthens me to feel like I am worthwhile just as I am. Now, that doesn't mean occasionally people will take that to mean like, oh, well, you're spoiling the child because the child can do anything he wants. No, it's that we can do both at one time. With children, we can say, it is okay for you to feel angry, but you may not hit your sister or you may not break things. So it's different that the two different things are happening here. One is the parent is letting the child know that how they feel and what they think is valid, and that they may feel that arises naturally. Of course, it happens in every life. But what they do with it is a separate thing. And that has to be, we have to learn what is appropriate in what we do with our anger, for example, or our sadness, or whatever it is, sexual feelings. What we do with it is a totally different matter. And that we have to think about that, or we have to be taught what is appropriate, or what is reasonable, or what is good. And so the person can always be affirmed, but this is one of the areas where I think a lot of times parents have not known how to do that. They've not been affirmed in that way themselves, and so they do not know how to affirm a child with all the different feelings that the child has. But that is essentially, we always need to receive from another person. Even this is being strengthened emotionally. We can be strengthened physically with food and shelter. We can be strengthened intellectually. We can be strengthened spiritually. But that does not mean that we are strengthened emotionally. That has to be something that is really very intentional. And I think more people are learning about that, how to parent well, but they also sometimes need to learn themselves how to do it. How to live that way themselves so that they can strengthen their children by loving them just as they are and their own personality, while at the same time guiding them to know how to live with other people, and so that they can strengthen them so that they can, in turn, like it says in Luke, to strengthen their brothers. Right? Because that's really what Christ was doing with the apostles. So he strengthened them in many different ways. He taught them. He was telling them that he was who was to come. He was interpreting the scriptures for them. He was offering healing. But I think he also affirmed them emotionally, and that's why they also loved him. They knew he was the Messiah, but they also loved him, I think, with a deep affection because he loved them first. And that's also what John says in 1 John 4:10. And this is love, not that you loved God first, but that God loved you and sent his son to be the expiation for your sins. So it's even there, John is saying, first we receive the love of God. And that is something that we want to teach people. We want to really teach people to live, every person to live the affirming life, which is to really live in a more receptive mode, a more where we are learning how to be who we are, and we learn about ourselves through how we are moved by different things and the pleasure and goodness of those things, like food and music and the fine arts, the things I was mentioning before. And that also brings a great sense of peace. And a sense of enjoyment that life is good. And so that is how people can actually help themselves, even though they cannot affirm themselves, because that has to come from another person. That love because as I said before, we don't grow up and we're not designed to live in a vacuum, like we're totally self-sufficient.
Yes, yeah, very well said. Dr. Sue Baars is with us. And, in this 1981 talk by your father, Dr. Conrad Baars, that I've been reflecting on, he says, our increasingly unaffirmed world with people who cannot affirm other human beings is a great tragedy. And it would certainly seem that him saying this in 1981, it's only become an even greater tragedy now, these, over 40 years later. And Can you help us to see the distinction between what we're talking about here, this authentic affirmation, this authentic affirming life versus the sort of pseudo affirmation, the pseudo affirmers, as your father calls them here? How do we see through that and make sure that we're looking at the real thing?
Oh, that's a great question. The pseudo affirmers. Well, let's put it this way. When we learn how to live the affirming life, we meet people in openness. We're open to who they are, and we're not coming with a lot of expectations of who they should be for us. It's more, I want to be open to who they are, and I want to allow myself just to be myself and to be open to be moved by their goodness, or maybe I'm not going to be moved by their goodness because, and I'm not talking about therapy here, but just in general, sometimes I'm not going to like every person, right? So I need to be open to a person just as they are. But the pseudo-affirmer, I think many people have a very good intention because they want the other person to know that they care for them or that they have good qualities. They want to give a pat on the back, but I think what they miss is this way of being receptive in their feelings, that they allow their feelings to be moved by the other person. It's sort of like maybe a good example would be taking care of a baby, but never allowing, like just taking care of the baby's needs and feeding the baby, but never really just being with the baby and letting the baby move me, and to sort of laugh with the baby or talk to the baby, because that creates a little relationship there. It's very different than an adult relationship, obviously, but it's this beautiful little mutual giving and receiving of oneself to the other person. And the beautiful thing that I like to point out to people is, when we are like that, let's say with a baby, or it could be with a rose, I ask people, well, where is the origin of my feelings for the baby? And most people say, well, it's in you because they're your feelings. But actually, the origin of my feelings is the baby, because the baby is delightful and beautiful and cute, no matter what needs they have. And so actually, I allow myself to be moved by this little person, or by the rose, or by the mountain stream, or whatever it is, or the fine art, which does move me. Not everything will. And so it's actually this beautiful little giving and receiving, mutual giving and receiving. The baby will receive me back in a sense. They'll receive my receiving of them, and they are delighted by that if they're open to that, their needs are met. But the person who is a pseudo-affirmer wants to do something good for the other person, but they skip the being moved. They want to tell people things, or they want to pat them on the back. But you can also, I think, when we really think about it, we know when somebody is doing something for us or with us, but they don't really care about us. But they're just telling us, well, hey, that's great, you did this. But there's not really we can feel there's not a connection. And I would say, though, that the unaffirmed person, or the person with emotional deprivation, acutely feels that they feel that this emptiness, and maybe the intent is good, but they don't feel really received. I think all of us can say that, is that if someone is trying to be good to us and nice to us, we can tell if they really mean it and they really care about us, or if they're just saying those words. And that's what pseudo-affirmation is. It's like doing all the right things, maybe with good intent, but it's like they're missing this personal encounter where they really are receiving the person and their feelings. And I think a lot of times we have gotten into the habit of thinking, or society has gotten into the habit of thinking, is if we just do something for other people, or if I tell them the truth, then that's all I really owe them. But I don't think that really sinks into the depth of goodness where we can really be present, And I think in American society, as much as I love this country, we are really caught up in the work ethic and in producing things and making things happen, which is a very good thing. But when we don't have that personal encounter, it's sort of like it misses the point, and we can just get all these things done without really feeling like we're connected to other people and loved by other people, or that we are able to receive other people. And I think if people really could stop and reflect, I think it takes a lot of reflection to understand what it means to affirm. Because like I said, some people take it as, well, I'm going to do this to another person. I'm going to go run out and do it. And it's more about learning how to be still inwardly and to be open inwardly and to allow ourselves to be moved in our feelings. And so it can be amplified or complemented by, is a better way to say it, by what I say to the person or something that I may do. But that is secondary. It is not primary. And so pseudo-affirmation, I think, happens a lot when people are too busy. And I think that's probably part of the difficulty in many families, is that families are so busy doing all these good things with their kids, but I'm not always convinced that strengthens the child or the children to feel like they are really loved and accepted. They may get the scholarship, or they may get, the sports done, which is good, but I don't know if they really feel loved. And sometimes we run into those cases in our practice.
Sue Baars is with us. Dr. Sue Baars. Last chance to get a call in. If you want to get a call in, we'll bring you in on the final segment. 1-877-511-5483. That's 1-877-511-5483. And phenomenal stuff here with Dr. Sue Baars today. Again, you can find her good work, some great resources over at BaarsInstitute.com. That's BaarsInstitute.com. We'll be right back. Hello, welcome back to The Simple Truth. Jim Havens here with Dr. Sue Baars. If you want to learn more about Sue, her good work, her father, Dr. Conrad Baars, all the great resources over at BaarsInstitute.com. That's BaarsInstitute.com. In, again, this 1981 talk given by Dr. Conrad Baars. He says that every human being has a need to know the truth, natural truth, moral truth, so he can make himself strong by applying this knowledge to his own human being. That means that the true affirmer of another person also has to be able and capable and to know when to correct, when to punish, and when to teach and when to admonish. He goes on to talk about how with this pseudo affirmation that oftentimes they don't develop neurosis. They now become psychologically weak because they spoil themselves from an early age. They gratify all their sensual desires and feelings as early as possible, and that also brings about weakness. In fact, he says, I think it is the kind of weakness that is going to be even more difficult to cure, to heal, than the obsessive compulsive neurosis has ever been. He goes up to continue to hold up this great example of Jesus as the ultimate affirmer, ultimate strengthener, and he gives a couple examples. He gives when he affirms Peter, saying, "You are the rock," right? Very affirming here with Peter. But then, just as he is that way affirming, he's also affirming when he's addressing the crowds and the scribes and the Pharisees, and he speaks words of affirmation in this way: "Woe to you, you frauds, you blind guides, you blind fools, you viper's nest." He says those were words of affirmation. We would never do it because it would hurt other people's feelings, but Jesus knew that he hurt their feelings. He got their attention in one of his last attempts to teach the truth to the scribes and Pharisees, necessary words. So Dr. Sue Baars, help us to understand this, that there's a way this works. There's a right ordering of the emotions, what you were talking about. That's what we're after here, to have the emotions rightly ordered and functioning as they ought to within oneself. And at the same time here, we should be responding to things as appropriate. and some things are going to need to be admonished. Now, we need to be careful about this, that we're getting it right, but we do see that example of Jesus here and your Father saying, look, this is affirming, and certainly it is. We know that Jesus is love itself come to us, and yet he gives us this example in this way. How do you make sense of it? How do you help people to, again, understand what is authentic, affirming living?
Yes, I think that we have to understand that there's two ways to affirm people. We can affirm people intellectually, which is really what the Lord was doing with the Pharisees and the scribes. He was telling them the truth about themselves, which it hurt their feelings, it made them mad, and then they wanted to kill him, which they did. But it also needed to be said, right? It's sort of like, I often think, they had hardened hearts. And when you have a hardened heart, what's the only way you can soften it? Is maybe to hit it, right? And to open it. So he told them the truth. He also did that with Peter. He not only called Peter the rock, but after he had, and I think this was at the end of his ministry, so he had known Peter for at least 3 years. And when Peter says, Jesus says, I'm going to Jerusalem and I'm going to die. And Peter says, oh, never say that. Don't let that happen to you. And he turns to Peter and he says, get behind me, you Satan. You are thinking like man, not like God. And so that must have hurt Peter's feelings, but it got his attention. But it was in the context for Peter, and I think the other apostles, of all the love and the emotional affirmation he had given them as his friends and his disciples. So I think with the Pharisees and the scribes, they didn't have the emotional affirmation because those things needed to be said in such a way that they could actually receive it. And I think because it was difficult, they did receive it and they didn't like it, but they also needed to hear the truth. And sometimes I think all of us need to hear the truth, but it's not going to be something we like to hear. Now, I do think sometimes, I'm sure lots of people that are listening could say, well, gosh, I've got these different situations with my family members who have left the church, or they're doing this or that, which is really against church teaching. I know that they're hurting themselves or they're straying from the faith. And I think we have to weigh, each person needs to weigh, and maybe they need help weighing, like, what do I say to my family member in love about what they're doing? And also the other question is, can I do that without losing this relationship? And how do I affirm them because I love them, but at the same time tell them the truth? So that there we have this intellectual affirmation, and we have to weigh, can we do it, or how do we do it? And the emotional affirmation, and maybe we need to talk about that first. Right? So I think there's two ways to look at affirming a person. So it's not only going to be emotionally, because sometimes the hard truth needs to be said, but perhaps it needs to be said in such a way we need to think about, can the person receive it at this time in the way I want to say it, which may be very forceful. And maybe we need to learn how to restrain how we say something so perhaps they can begin to hear like a piece of what we have to say, so that at least I maintain the relationship, so that later on, maybe I can also keep telling them the truth, a little bit of the truth. But we also have to, I think it was St. Thomas Aquinas said, a thing is received according to the mode of the receiver, which means I need to think about, how can the person receive this, or are they at a place where they can receive it in this way, or do I need to modify that? And so I think what we want to do is sort of like what the Lord probably did, is he taught the fishermen who were the apostles how to fish for men in a particular way. Now, excuse me again, the other side of it too is Jesus did go into the temple, and he was very angry, and he threw people out that were doing something wrong. But that needed to be done because it actually was an act of kindness, because he didn't let them stay in their sin. It's one thing to, and these are difficult situations now in our world, but it's one thing to love a person and be kind to them and be emotionally affirming, but say nothing. And so sometimes, and I'm not saying people should run out and just say something to their family member. I think that really has to be contemplated, like, how do I do that? And is this the time? And I need advice about that. So I hope that was helpful in answering your question, Jim.
Great. And I love this. This is a great way, I think, to wrap up here and get your comments on this. At the end of this 1981 talk by Dr. Conrad Baars, he says it this way, and I think maybe this is helpful for us to hear right now. He says, "Now, if you are confused about what affirmation is, I will be very happy. Begin to think about it." He says, "I made a mistake. When I first heard about it, I thought I knew it. It took me many, many years to learn about it. I still don't think I have exhausted the whole topic. I am still learning, especially from my patients. I see some of them with tremendous insight, tremendous sensitivity, severe neurotics, unaffirmed people. They suffer much more than I ever did in concentration camps, prison, or whatever. We learn all the time by being present with our whole being to our patients, to our spouse, to our children, to other human beings. This, of course, involves many other changes that we have to make in life. We have to be less busy, think less, listen less to all the turmoil in the world. We have to be more quiet, have more time for meditation and contemplation, more time to be alone, and more time to be by ourselves." Dr. Sue Baars, can you speak to why that's so important here in the final comments here?
Oh, I think that's exactly right. And I think when I look back on that, and I know my father was at the end of his career, I can say the same thing after all the years of being a therapist. I think I have learned so much, and I continue to learn and I can continue to ask myself, what does it mean to affirm? What does it mean to be present? What does it mean to be open and receptive? And it's like, it's something that you always can go deeper, and you always, I think if you're open to that idea of affirming living, you can grow, but you do have to be more open to just being receptive and just allowing people to move you and things to move you. And that is how you will grow more capable of loving.
Wonderful. BaarsInstitute.com, BaarsInstitute.com.